in front of you?
It's good right now.
That's great. Thanks very much. So we're thrilled to be able to talk to you this morning about public health research within the NIHR. This is the agenda that hopefully you've all seen. So there's quite a lot to get through. So I'll press on, but we're hoping to have lots of time for Q&A at the end. I'm going to speak first, and then Joe's going to speak and give a case study, and then Ruth will be joining us for the Q&A and has contributed to the slide set that we're using. Please use the chat function if you can to say where you're based and what your job is, and any questions that occur to you during the presentation stage, so that we've got these down for the Q&A. So I was asked to give, first of all, a sort of helicopter overview of the public health research programme within the NIHR. I know Brian Ferguson's already spoken to this group, so I hope I'm not duplicating what Brian said. There's quite a lot of embedded web links and detail in the slides that I'm going to be used, and we'll make these available to you so that you can follow those if you want to. So, as I'm sure you're probably all aware, the National Institute for Health and Care Research is the largest research funder of health and care research in the UK, and its mission is to improve the health and wealth of the UK through research. And the way that the money comes from the government is via the Department of Health and Social Care. But there are lots of different parts to the NIHR. And the part that we're, of course, particularly interested in is the public health research programme. And this is really focused on providing evidence around the delivery of things that don't happen within the NHS. And it's also very much focused on health improvement and reducing health inequality. But it also has now a very clear strategic aim of building capacity within public health research, because it's recognised that that was something that needed to be done if we were going to be able to build that evidence base. I've been involved in this programme since its inception, and I think one of the things that's really changed in the time that I've been involved is the recognition that it's not that we really have to bridge the divide between academic research and practitioner research, and a real strong now recognition of the importance of practitioner academics. This slide actually came from one of my colleagues who works on one of the programmes that we're going to be talking about. And there's been a clear recognition that the evidence base suggests that research active organisations deliver better services and make better decisions if they are research active. So there's, as we'll see as we go through the presentation, there's a lot more support now for people wanting to train and do research, build their research capacity through the NIHR, but from a more service setting, and a lot more support for collaborations between academic institutions and service-based organisations. So I'm just going to walk you through very quickly the different elements of this public health research programme. So the first thing is that it funds research, public health research, and it has an interesting way of doing that, which is different from some of the other research schemes within the NIHR, in that when research proposals are submitted to it, the first people who look at it are practitioners, and they screen all those proposals and make a decision about the relevance of the work being proposed, and whether they think it's relevant to practice. And if they don't think it's relevant to practice, then it doesn't go forward to the funding committee. So that's a more unusual way of working. And the proposals that go forward can go through two different routes, as it says on the slide here. One is that people can suggest things that they think should be researched, but the programme also puts out lots of commissioned calls, and they usually do that they have the call out for at least a couple of cycles, sometimes more, of the funding round, so that it gives people time to work up good proposals to address that commissioning brief. So the next thing that it's important to talk about, and this is very much the latest infrastructure that's been put in to try and support what I was talking about a minute ago, about these collaborations between academia and practice. And these are health determinants research collaborations. As the name suggests, obviously a very strong focus on health inequalities and the wider determinants of health. A series of those with the names on the slide have just been funded. The ones with asterisks are getting development funding with a view to them becoming full collaborations, and there are other competitions underway and envisaged, so there'll be more of these to come. And you know, as it says on the slide, they're very much designed to build capacity and capability in public health research in local government. So again, unusually, local government were the people who led these bids, with the academic collaborators kind of being in a secondary role. And the idea of these is, again, to help wealth generation, but also very much about embedding an evidence-based decision-making culture within local government, because obviously that's local government has worked very different. For those of us who remember PCTs and things like that, there was more of an evidence-based culture already embedded there because they came from a stronger health background. But also there are other things that are important in terms of public health research, and one of them is the FIND scheme, which funds very early stage work, intervention development work, which is quite hard to get funding for. This panel is actually run, it's an MRC, a Medical Research Council run scheme, but it coordinates with the NIHR. And I've sat on that funding panel, and it is a really usefully funded panel. The amount of money involved is not huge, about 150 to 200,000 pounds, but it is a really useful stream. Then we have ARCs, Applied Research Collaborations, and they're mainly focused, or more focused, on health services research, but some of them, and certainly our local one in the Southwest, also has a public health research funding stream. We have, I think, 13 health protection research units, which obviously address that part of public health work. And then there's the policy research programme, and the PRUs have different flavours, but there has been a public health research focused one. They're just being recommissioned. And then new in the firmament is a new addition to the research design service called FRADA. PHs allow lots of fancy acronyms, and so this is part of the research design service, which we've had for a long time in England, but the FRADA is specifically there to support people wanting to develop applications to the public health research programme, and particularly help with commissioned calls, and that's again to really support people who may be coming in from areas which are not more non-traditional areas perhaps, and may not be so familiar with how to present the research. So moving on then to another part of the NIHR, which is the NIHR Academy. So the NIHR Academy is the sort of training arm of the NIHR, and they offer lots of training support, but I'm just focusing on one aspect of that, which is the different fellowships that they offer. And as you can see here, this table has these schemes by the level of fellowship, and then divided into ones which are specifically about research training, and then ones which are research training but specifically for practitioners. So these ones, the research training ones, these schemes are highly competitive, it has to be said, and are cover all levels of people's career development. So of particular interest perhaps to this audience is the Population Health Career Scientist Award. This has been reintroduced. It existed many years ago, and happily it's been brought back because it absolutely has been instrumental in developing some of the people who now leads the field in terms of public health research. Ashley Adamson, who's the director of the School for Public Health Research, is a good example of that. But then going on to the practitioner scheme, these fellowships here are, as you can see, for clinicians. These fellowships are new and highlighted here because these are absolutely specifically designed to support people working in local authorities. So having a contract with a local authority is a key requirement of this scheme. And as you can see, they're offered at 3 different levels now. And the advanced fellowship, so the postdoctoral award, is new. That's just being offered right now. The other 2, there's already been some rounds of those. So that's a really important and welcome development here. And just Ruth wanted me to particularly draw your attention to the fact that if you're a non-clinical public health person and you want to apply to the research training scheme, there is, and you're on the public health training scheme, there is an opportunity to get bridging funding to help you develop an application because, as I said, these are highly competitive, and you need to spend quite a lot of time developing a good application. So there is a scheme there for getting support to do that. So I'm going to switch now and talk specifically about the School for Public Health Research. I've been involved in this since its inception, which was in 2012, and I've been the deputy director since 2017. And in that role, in fact, that role's been split now into 2 parts, and I'm just responsible now for the capacity development work. We get a considerable amount of money for our work. We've got over £30 million in total for this quinquennium, 5 million of which is earmarked for capacity building work. And you can see there that some of the additional money that we've been given is particularly to focus on novel approaches and groundbreaking ideas, and that includes stuff within our capacity building work. So it's a partnership between 9 leading academic institutions, and it only exists in England. And its aim is very much about building the evidence base for effective public health practice, and particularly focused on local authority work. So these are the member institutions, and it's important to just point out that some of these members, so for example, FPH actually has 5 different universities involved. So in the case of FPH, it involves Newcastle, Durham, Northumbria, Teesside and Sunderland. Likewise, Lilac is Lancaster and Liverpool, and Fresh, which has joined in this quinquennium, which is great because it covers the Midlands, where there was quite a gap before. That's a collaboration between Birmingham, Keele and Warwick. So just as the note says here on this slide, it's important that even if you are not necessarily connected to any of these universities, they are based in each of the regions, so there's still could be scope for you to get involved through a secondment within your training program, because they're regionally based. These are the principles that the school operates on. So you can see key amongst those is that we engage with policy and practice very much, partnering with them, and also very important to our work is working with members of the public and with communities, and co-producing all of the work that we do. So collaboration is really key to our work, and also making sure that our work is impactful and is going to help those working in practice to make better decisions about what they do. I've already hinted that capacity building is a strong feature of our work, and of course trying to make sure that we have a very transparent approach to what we do and following an open science agenda. And we're very much working in this quinquennium particularly on improving our practice around EDI. So I want to now let you know what our research programme is in this quinquennium. The way we get our funding is slightly unusual in that we get funded first and then we work out exactly what kind of research that we're going to be doing. We make some we give a framework as part of bidding to be part of the school, but that gets honed once we all get together as a school. So there are 4 programmes of work being undertaken in this quinquennium: public mental health, children, young people and families, healthy places and healthy planets. And they were all programmes that we had in the previous quinquennium as well. So there's a lot of continuity there, but we'll of course have different projects this time round. Health inequalities is also something which has always featured as a cross-cutting theme before in the school's work, but this time has a specific programme of work on that. In addition, we have always to have the health equity lens on everything that we do, and there's scope for work around COVID recovery and pandemic preparedness. And as you'll see in a couple of slides, we've got some special funding around those areas, but I'll come to that in a minute. Just to put some names to these programs and just say who's leading those. And if we'd been doing this talk for the last quinquennium, there'd be a photograph of Ruth Kipping here, because she led the Children, Young People's and Families, or co-led that programme last time with David Taylor Robinson at Liverpool. I mentioned just a minute or two ago that we had some additional funding. Some of that is for emergent health priorities. Obviously, stuff happens, and it's good to have some money earmarked so that if for evaluations and things that we can do and get in there. But we've also been given money for innovative work, and within the school that's going to be around data linkage. We've got some folk involved who are very expert at data linkage. Obviously it's very tricky work, but obviously very beneficial, and particularly looking at how we can use local authority data sets to support research. And also, we've got a very good group of health economists working within the school. So there's going to be a focus on looking at how to improve economic methods for public health. And we've also got, always have had a real strong interest in involving people in our work, not doing work on them, but with them. And so some more work to be done around how to do that and best practice there. And that work's led by GJ Menendez-Torres, who's based in Exeter. So capacity building is very much what I get involved in, and we've got a fantastic training manager, Andy Sull. And so if you've got any specific queries about what I'm about to say, she is the person to go to about that. So in terms of capacity building, we have several elements to our programme, again, trying to cover different career stages. So we first of all try to hook people in when they're still undergraduates, and offer summer internships of 6 to 8 weeks, ideally for people in their second year at university. We then have pre and postdoctoral fellowships for a couple of years, and also, of course, PhD studentships. And we have a very healthy early research network, which is not just our trainees, but also people who work on our research projects within the school. And we provide some seed corn funding for them, so they can apply for small research grants of up to 30,000, and they do amazing things with that money. The new on the block, this time we've got transdisciplinary placements. We want to try and attract people into public health research who have come from wider disciplines than normally is the case. So people who may be architects or planners or work in public policy. So that's a new feature. We're just about to fund some of those, and we will be offering fellowships for folk in that space as well. This slide is incredibly busy, and it's really just for information only. But for those of you who are particularly interested, it does show you the dates when we're having recruitment rounds for these things. And the recruitment to all of these things is largely national. And so if you're interested in those things, then you'll get these slides and you can follow up. So how could you get involved in the work of the SPHR from where you are? So first of all, you could think about, did you want to get involved in any of the research programs or the research projects or the networks that already exist, because you've got some relevant expertise to bring, and you might be able to bring some additional capacity, research capacity to bear on it. Or you are able to facilitate partnership working with public health practice, to offer sites for field work, and to help with a knowledge exchange. All of those things are really valuable to the people in the school. Sorry, that's gone too far. Let me get back. It's very sensitive. If you want to know what work is going on, then the website is where to go for that, and I've put the link on there. Some projects are already up and running and funded, and this week we agreed the funding for another tranche of projects. So that's very much an emerging picture. So it's worth going back to the website to see what's happening a few times. You're also very welcome to get involved with our capacity building work. All the trainees are asked to have someone who's a practice partner as part of their supervisory or mentoring team, so there's opportunities for engagement there. And all our trainees are asked to take a practice placement of 6 to 12 weeks. And so if you're able to help facilitate that, then that's also incredibly welcome, and that can be done as a block or as a sort of day a week. And I think from your point of view, these are all opportunities to get involved and to hone your own research ideas and interests and thinking. Great opportunity for networking, and also chance, if you're involved with projects or with trainees, to be involved in knowledge mobilization and to be involved in co-authoring outputs. And we do not just journal articles, but we produce briefing papers and all sorts of other things. There's been a bit more funding offered in what's become called 3 schools funding. So you may or may not be aware that the School for Public Health Research is one of 3 schools that the NIHR funds, the other 2 being primary care research and social care research. And so the NIHR has decided to make some additional funding available just to people involved in those 3 schools. And I think that's been designed particularly to stimulate collaborative research between the 3 schools. It's been difficult in the past to do that because we are on different funding cycles. But this work allows us to sort of bridge across that, so that's very welcome. So far, they've just done that in 2 programs of work. One, a program of work on mental health, and you can see the funding has been quite substantial. And again, that's had capacity building built into it. And that was led by School for Primary Care Research. There's also been funding for dementia, slightly less, and that was led by the School for Social Care Research. There is a question mark about whether the School for Public Health Research is going to be asked to lead a programme of work, and that is certainly under discussion, but there's no detail on that yet. So just one final thing to say about a funding stream within the School of Public Health Research. In the first 2 quinquennia, we had what we called our FES programme, which was Public Health Practice Evaluation Scheme. And this was a scheme whereby local authorities could suggest to the School for Public Health Research that they had an intervention or a policy which they thought was quite novel and which they wanted to evaluate but didn't have the capacity to evaluate themselves. And that was done done and coordinated on a regional basis, and that was so successful that the NIHR decided that they were going to set up a separate infrastructure to enable that to happen, and that has become the FIRST teams, which I'm going to talk about in a minute. But because of that, within the school, then we've decided that we don't want to duplicate that work anymore, so we're going to pivot a bit, and we are instead going to offer the same kind of thing, but to the voluntary sector. So that's just being worked on now. So it's not happened yet, but we will be looking for expressions of interest for that work, for those evaluations in the not too distant future, and also possibly something around COVID work, but or crisis and climate crisis stuff, but that's still not that's still kind of very much on the back burner right now, but I'm sure we'll get to that. So to move on then to talk about the FIRST teams. So the FIRST acronym stands for Public Health Intervention Studies Team, and at the moment there are 6 teams throughout the UK funded to undertake these evaluations of local authority initiatives. Local authorities propose the initiatives, and then they are allocated to one of the FIRST teams, who then work to co-create the evaluation that is then undertaken. And again, you know, the aim of this is similar to the work of the School of Public Health Research, in that it's about trying to enable good decision making, and also, of course, building the evidence base for public health practice. You can see here that these are the 6 teams that have been funded so far. The one that I lead is called First Insight, and our team is based is a collaboration between the University of Bristol and Cardiff University, who we've worked with for many years. And the other teams are similar collaborations between groups of academics around the country. And you can see these are where all the dots represent where the different evaluations are underway, and they're probably more. This slide is probably slightly out of date, because there probably should be more dots on there than there are. So the rationale really for this is that, you know, the local authorities are often doing lots of interesting and exciting things to try and improve health and reduce health inequalities, but they don't necessarily have the capacity to evaluate that. And obviously, if things don't get evaluated, it's really difficult to argue, and there isn't evidence to support those initiatives. It makes them more vulnerable to not being to continue being funded. And so that's really where the FIRST teams come in. And so these are just some examples of projects that are being funded, and you can see they're all over the country, and they are very varied in terms of the kind of initiatives that we are asked to evaluate. If local authorities want to have an evaluation, then they complete an expression of interest, and that's via the NIHR website. I'll come back to the issue of websites in a minute, and the initiatives just have to that want evaluation, just the main thing is they have to be intended to have an impact on the health of the local population. It's very much designed in a way that making the expression of interest is not onerous, but it is a competitive process. And the evaluations are typically intended to last between 12 and 18 months, and to be done in as robust a way as possible. So i.e. trying to do good scientific evaluations, and generally we spend some time initially trying to make sure that we understand what the logic of the intervention is, and understanding how it is intended to change things. and also to trying to make sure we're really clear, everyone's really clear about what the research question is, and they generally involve mixed methods. In terms of websites, this was the issue I wanted to just mention here, because we've, as a group of first teams, we've set up our own website, the links here in this slide. And that's because so that we can provide information to our audiences, local authorities, the public, and so on, quickly and in a tailored way, which it would be much more difficult to do on the NIHR website. So I just wanted to mention that. So again, how, from your point of view, how could you get involved in this work? Well, again, you could get involved with the first teams and projects if there are things going on in your patch. You could, again, get involved as someone who's got relevant knowledge and expertise and add research capacity, and also facilitate partnership working and field work and so on. You could also get involved with capacity building. We've already looked at all the different schemes that are now available through the NIHR Academy, so you could be supporting colleagues to apply for those schemes, and also could potentially gain experience as a supervisor via those schemes. And again, it's an opportunity to hone your own ideas and interests and network, and get involved in knowledge mobilization and co-authoring a variety of outputs. Just very quickly wanted to say something about public health incubators. So the NIHR has funded a whole series of incubators. They're really designed to try and build capacity in certain areas. There's not been a huge amount of money devoted to those, and so generally these have worked by trying to get some kind of at least shop front and to guide people into how they can develop research capacity, and what opportunities are available for doing that. These are the aims and objectives of the Public Health Incubator that we currently have, and as I say, a lot of effort, because the funding is very limited, has gone into trying to build a website, which in our case is still under construction. But we would be really interested perhaps in the discussion today to hear what you would welcome from a public health incubator. So that's all I've got to say, and I'm going to stop sharing now my screen, and I think we'll go over to Joanna, who is now going to present a case study kind of showing how what her career journey's been like, and hopefully relates to some of the things I've been saying. So thanks, Jo.
And just finding my screen to share. Give me one moment. Must do have vanished off the list. Any clues on that? It's a bit of a mystery. I'm not sure why it's not showing up on my choice of things to share. Hold on, let me reopen it and see if it will come back. While I'm doing that, so I'm here today. I'm an ST5 in public health, and Ruth Kiffing's my academic supervisor. I've been going through the training programme, and I'm just going to give you 5 minutes on really sort of the where, why and how the various academic opportunities have worked for me through training, as I'm someone who came to training not really anticipating looking for or following an academic career path, but the interesting projects that I've come across along the way, as well as the opportunities that have been out there, are what have inspired me to come to the point I'm at now. So I'm out of programme at the moment, doing an NIHR doctoral research fellowship here in Bristol. So hopefully that's working now. Can you see that okay?
Yes, that's good, Joanna.
Great, okay. It looks like from the chat that quite a few of you are in either the same position as me doing a fellowship or further on in your academic careers. So what I'll focus on is maybe how you as supervisors or colleagues could help people in a similar position to me, or more junior in training in identifying some of these opportunities and supporting them to take them up. So my background's been through medical school, and I integrated and worked out that lab-based research wasn't really for me, but that I was interested in the academic process and in the foundation years of training, which I think is now called the Specialised Foundation Training Programme. I had the opportunity to do 4 months of an epidemiology project, which is, I think, what opened my eyes to public health for the first time. But still at this point, I was very focused on a hands-on clinical career and hadn't really come across either public health or academic work particularly. But so having found some frustrations, I'd say, with treating people in end stages of chronic disease on the acute wards of Bristol's hospitals, I decided public health training was for me, and that's been a really good match. But I'm not even sure if there was an academic clinical fellowship advertised in the year I applied. It wasn't something that was on my radar. I applied to the standard scheme, intending to fulfil the curriculum through the standard sort of service provision placements. But here in the Southwest, our first year is a master's degree in public health. So I did that at the University West of England. And that was probably one of the first main opportunities in terms of academic opportunities. So Ruth, as my supervisor, helped me carve out some time and provided some expertise to translate the systematic review I'd done for my master's dissertation into a publication. I think that was one of the first steps on the process for me, of realising this was something I was good at and something that could fit with training quite easily. The next couple of years then, across the health protection placements and local authority, I came across a few different research questions and collaborated with people to turn those into more academic focused projects where that was possible. But it was while I was at a local authority placement with a CCG, a commissioning group, who was interested in putting in a delay on the pathway to surgery for patients who either had obesity or who were smokers looking for joint replacement. Introducing a policy whereby there'd be an extra waiting time for patients in that position to try to lose weight or stop smoking. And credit to that CCG and the local authority, they were really keen to do a robust evaluation of what a policy like that might achieve, what the impact might be. And it was a project I was asked to contribute to as a registrar. And for me, this has formed the research question that still keeps my academic brain up at night, I suppose. It's what I've worked on from that time, and it's formed the basis of my fellowship now. And for me, an opportunity at this point then was ARC West, so the applied research collaborations that Rona mentioned. I was able to approach them with Ruth's help to get their help with this evaluation, and ended up being a collaboration. And so it's really their resource and their ability to help navigate things like the ethics process and the methodological considerations needed to turn that evaluation into something really meaningful, that meant I could turn it from what was potentially quite a small scale registrar project into something that turned into an interview study and also a feasibility study looking at the kind of data involved in that question. I was working on that about a day a week. And so at that point in training, an academic clinical fellowship did come up. And again, I'm not sure it's something I would have noticed or applied for had it not been for guidance from my academic supervisor. But pleased to have started that at the end of ST3 year, which gave me about a day a week of training time, which I used then to write up that health optimization work, and also to take about a year, I would say, to put in a fellowship application for the doctoral research fellowship. So I started that in my final year of training now, so out of programme for 3 years. And as I mentioned, I'm picking up on that same policy area of interventions ahead of elective surgery for patients with obesity or who smoke. And I'm looking at how that varies across the country and the effects a strict policy has versus a more sort of holistic advice-based approach for patients in that preoperative window. And I've got 4 supervisors across the university then, so I'm trying to look at different methods. I'm doing a qualitative project and a health economics project, as well as the quantitative study I've put on screen for you there. So yeah, I think really this has been a gear shift for me, having these 3 years out of programme to really experience what an academic job is like day to day, and certainly feel inspired to continue with this research topic. And so perhaps next steps for me would be an academic clinical lectureship post to return to for the rest of my training, and I would look to try to put this into potentially an advanced fellowship application to continue with this work. So on reflection, this isn't where I saw myself when I first applied for training, but really pleased to have had the opportunities I've had, and definitely key has been the involvement of the university and academic supervision in identifying those and having the time and space to apply for them effectively. Yes, so my contact details are on that first slide. Happy if anyone to get in touch about applications, interviews, things like that. Always happy to talk through those. Or perhaps there are some questions now in our Q&A section. Thanks very much.